Hello, my name is Eugene Davidovich, the San Diego Chapter Coordinator of Americans for Safe Access. And today, I'd like to talk to you about the unincorporated areas of San Diego County and the County Board of Supervisors' efforts in regulating medical marijuana dispensaries in those areas. In June of 2010, the County Board of Supervisors adopted an overly restrictive ordinance that effectively banned all access to medical marijuana in the unincorporated areas of San Diego County. Since then, not a single collective has been able to come into compliance with this proposed ordinance. On January 25th at 9 a.m., the San Diego County Board of Supervisors will be meeting to discuss and vote on the amendments to the proposed ordinance for the unincorporated areas of San Diego County. These amendments include a few changes to the ordinance that was adopted in June of 2010. Some of the changes are setting a fee for medical marijuana collective facility operating certificates, restricting marijuana transactions to collective facilities on site only. Now this is very interesting because the actual language of the change that the county wants to implement for this amendment is that they would like to only allow deliveries of medicine to patients that belong to the collectives in the unincorporated areas which have been licensed by the Sheriff's Department in accordance with this new ordinance, which means that any delivery service or any collective delivering medicine to a patient living within the unincorporated areas of San Diego County would be now in violation of this ordinance. This essentially bans delivery services in the unincorporated areas of San Diego County. Another change that the supervisors will be making on January 25th to the ordinance, which is already overly restrictive, is that now they will be requiring an FBI criminal background investigation as a part of the application to obtain a medical marijuana operation certificate. The fees that the County Board of Supervisors would like to impose on the certificates of operation for dispensaries in the unincorporated areas is $11,000. That's right, $11,000 paid annually would be assessed on any dispensary that actually comes into compliance with this ordinance. This is the most expensive licensing fee for any business within the county unincorporated areas. Firearms dealers, adult entertainment shops, any other business in the unincorporated areas pays a much less certification fee and processing fee to stay in operation. Handicapped patients, patients who are terminally ill, the sick and the dying will now have to come up with $11,000 annually in order to collectively or cooperatively cultivate legally in the unincorporated areas of San Diego County. Now let's take a look at some of the requirements that are part of this ordinance that was adopted back in June of 2010, which not a single collective has been able to come into compliance with. First, a record identifying all current qualified patient members of the collective associated with the collective facility has to be kept on site and made available to the Sheriff's Department for inspection at any time. This information is supposed to include the patient's name, the patient's address, the name of the physician providing the recommendation, and any other medical records associated with this patient and maintained at that facility. A record is supposed to be kept identifying the source or sources of all medicine, that's right, all cannabis, currently on the premises of the collective facility or that has been on the premises in the last 2 years. And this record is supposed to be kept on site and made available to the Sheriff's Department, the same Sheriff's Department of which Steve Reed, San Diego County Sheriff and marijuana eradicator, has been using the federal laws and other means to eradicate medical marijuana in San Diego. Now Steve Reed, along with his narcotics task force buddies, are going to be walking into these facilities and inspecting these records and collecting this information in accordance with this proposed ordinance. Every single patient that contributes their excess medicine to the collective is supposed to sign an agreement, and the agreement binds that patient to also provide all of his information as well as make available his cultivation site for inspection by the Narcotics Task Force, the Sheriff's Department at any given time. And that is supposed to be maintained on the collective at all times as well. The location of the cultivation of the marijuana supplied by the member shall be subject to inspection for physical verification by law enforcement or fire agencies at any time. A record showing the identification of the responsible persons for the collective, that's name, home, address, telephone number, must be available at the Sheriff's Department at any time. The ordinance also prohibits the consumption through smoking, eating, ingestion of any way, shape, or form of any cannabis on site of these facilities. Collective facilities shall be available for inspection by the sheriffs and the fire department at any time during their hours of operation. That is what the ordinance currently requires. The ordinance also requires that a licensed uniformed guard be present on site at the collective facilities during all times of operation. Not a single facility has been able to come into compliance with this overly restrictive county ordinance since June of 2010 when this ordinance has been enacted. Now the county board of supervisors is trying to make it even more restrictive. They're banning delivery services from accessing patients in the unincorporated areas of San Diego County. They're imposing an overly restrictive and very high fee of $11,000, which is the highest annual fee that any business in San Diego County currently has. On January 25th, the San Diego County Board of Supervisors will be taking up these restrictive amendments to the ordinance. I encourage every single patient to be there and to speak out against these restrictions and to urge the County Board of Supervisors, specifically Supervisor Roberts, to put a motion on the table that would revise this overly restrictive ordinance, send it back to staff for input from the community and the patients to actually allow a collective to open. Right now, the San Diego County Supervisors have banned all access to marijuana in the unincorporated areas for patients who need it most: the sick, the dying, the terminally ill, the patients in our hospitals, the patients in the convalescent homes. Now they will be without access to the medicine that helps them live in San Diego County, thanks to the County Board of Supervisors, whose bias-driven agenda has flourished in the county and has effectively eradicated all access. If you are a patient in the county, you have to be there on January 25th and let your voices be heard. To get more information, please visit our website at safeaccesssd.org. To see all of our news briefs, visit our channel on YouTube at youtube.com/safeaccesssd.